am at the hospital outside of where Jared is getting his surgery today on his ears, and I really wanted to talk about kids who have been orphaned or, haven't had a family, and their eyes and their ears. Jared and Grace both have holes in their ears because of really bad ear infections for years in Africa that basically burnt holes in their eardrums. So when they first came here, we just thought maybe they were loud, maybe they didn't understand us because of the language, and then we discovered that their hearing actually was compromised. And the holes in Jared have been actually getting bigger, so he's getting one ear, it's not tubes, but he's getting the whole cover, and we're hoping the hearing will go up. When the hearing is compromised, what happens is that learning can be compromised. So he's been having some issues in school. He's very well behaved. He's a great kid. He just is really struggling with learning. So we're hoping that the hearing thing will help. In here for Jared's ear surgery. And he is putting on the blue socks that they have given him. You like those socks, don't you?
Yeah.
You think we're going to get to keep those socks?
That's what I'm wondering.
Yeah, so can you stand up and model your outfit for me?
Maybe next time.
How you feeling about this whole ordeal? Let me see. You definitely look like you need to be a shepherd in the Christmas play. Look at me. What do you have to say for yourself? How you doing? Are you nervous about this at all?
Yeah.
Yeah, you are? What are you looking forward to? I'm going to buy you some food that you like after this. Okay? This is, Jared, this is video, not, okay, but you're giving me a thumbs up? How come, baby? What do you think? It's all good? I like that outfit. Blue socks and a white robe. Why don't you sit back and watch some cartoons? Tell me how you're feeling.
You gotta look at the camera.
Funny.
Is this for real?
Jared, this is hilarious.
You said in 30 seconds it would be...
I feel sleepy.
You can go to sleep, buddy.
You get to take a good nap, Jared.
All right. Come here. You're going to give me a... Jared, you're going to be great, okay? I'm going to go home. I'm going to buy you whatever you want to eat, okay? And then in this video that I'm putting together, I wanted to talk about eyes. Kids, oftentimes who haven't had parenting in their early years as infants, can develop, because they haven't been tracking properly, can have eye issues. So if you're adopting, always get their eyes and their ears checked. So Matea and Alec both, I'm being paged, they have Strabismus and Amblyopia. So they have some eye problems and that we're getting corrected. How long have you had your glasses, do you think? Like, how old were you?
Like 2.
Mm-hmm. And what else do we do sometimes to help with your eyesight?
It's been 5 years since I had my glasses.
Yeah. And we patch every now and then, right? But less than we used to, like, not so much.
Well, can I get off?
Yes, sweetie. And Matea, how many different pairs of glasses do you think you've had? Yeah, probably. You're probably right.
And the pink ones, black ones, my brown ones. Oh, yeah, my pink ones and my purple ones.
Yeah, you look beautiful in glasses, by the way. Alec.
Mommy?
Where are you?
Can we wear shorts?
No, not today. It's too cold. Hey,
But
Alec.
Alice is going to be 63.
That's still, let's not wear shorts today. Look at me, look at me. So, you wear glasses too, right? Does it help you to see better, you think?
It helps me see better without glasses.
Oh, you take your glasses off, you think you see better? Yeah. Look straight at the camera. See this eye over here? It sort of turns in. He has what they call strabismus, and Matea has amblyopia. So it's training him to see better. and it's not so uncommon for me with 5 adopted children, to know that, you got to check their eyes and ears. But I didn't just know that. It happened because I'm, was like, what's going on with my kid,
Right.
So, with Alec, they're saying that he could possibly need strabismus surgery.
But I don't need it.
Okay, these two kids, both of you stand. I want to show him something. With Matea, this is her good eye. Wait, no. Yeah. Wait, wait, hang on.
You don't remember.
No, this is her. We patch this eye.
So this is good
Okay,
eye.
we patch the other one. So I guess we patch. Do we patch the good eye, right? We patch.
Oh yeah.
Good eye, typically.
Okay, and then with him we patch the other eye.
This eye.
No, we patch that eye. So they have like the opposite. She's done great strides. Matea's just doing great because she's been doing that since she's been 18 months. I think her vision's like 20, 25
You're
or
upside
something.
down.
He is still like he'll make strides, but then they still can see his eye sort of like moving around. Because a lot of orphans are labeled, and some it's correct, but with fetal alcohol syndrome and reactive attention disorder, they're oftentimes given this, reactive attention disorder. They're not bonding, they're not this, and they're not that, and they just say it's because of early childhood and the brain not connecting, but they don't really put 2 and 2 together with vision and how that could be corrected, that could also then correct aspects of the brain. Because they'll tell us things like hold the baby, try to reconnect the bonding experience, but then they don't get any more in depth with the whole vision therapy thing. So I think between bonding and correcting that, obviously then neurologically it would make sense that you'd be also giving them great strides in healing that way too.
Well, and it's amazing to me to think that all of these things, that something he was born with, and wasn't treated properly when he was a child, how it trickles like a domino effect into his life, and that is the way it is for orphans too, because they're not treated.
They'll go into like their teen years still looking for a family with eyes severely compromised. Like Alec, yes, he's got a problem, but even we can't tell even over the screen. So it's not like it's a severe problem. But some of these kids have visible, whether it's amblyopia, strabismus, because I don't have the technical words, but you can tell like just by looking at them. But they'll go like for years, for like 12, 15 years. Without eyeglasses.
I don't know how much Deb talked to you about what vision therapy really is, but it's been around for well over 100 years, but at the same time, it's not widely accepted in the medical field. Mm-hmm. So you'll mostly hear people who are who've actually been on the recipient end of either experiencing it real life with a real patient that will finally the light bulb will come on, or you'll talk to somebody who's in the optometry field who has a strong research in it and then a lot of experience with patients. But if you talk to the medical field like MDs or ophthalmology, there are probably a lot of people. It's going to be really hard to find somebody who gives it any credibility.
Right.
But however, that being said, it's called vision therapy, but you're really training the patient's brain. I mean, you kind of touched on it when you said establishing like reconnections and whatnot. You're really teaching them all the things that if everything were developed properly, they would have learned without having to work on it.
Right.
Just as their regular development. So there's all kinds of different issues, but a lot of times with patients who are either strabismic or amblyopic or both, then you have other visual deficits that might not manifest on a regular eye exam unless you know what you're looking for. But as far as it's far-reaching, because somebody said, how can something like your eye turn, like if your eye is turned, or maybe your eye is, I'm not sure if Matea had an eye turn or whether she had a really high refractive error, or same with Alec, I'm not sure.
Yeah.
But, so a lot of times it's going to manifest in other ways, like Deb was hinting on. But it comes down to, you want to find out why are these all things connected? And it's really, the knee bone's connected to the whatever bone, and etc. It all works together. And one of the things that I had a lot of times with patients who are strabismic and they have an eye turn. Well, in order to not see double vision, the kid will tilt the head one way or the other, and it eliminates to some or reduces the amount of double vision they see.
Wow.
But then if you start doing that, think about like if your head's turned, you might end up having neck issues or lower back issues or whatever, because it all kind of works together. So with me in particular, I mean, if you have one eye, you need, in order to be able to be well coordinated, you need to be able to have both eyes working. Yeah. And in strabismus or amblyopia, a lot of times what happens is, and not every case, but you use one eye primarily, and the other eye you might use for your peripheral vision, but you only use one of the eyes to see straight ahead. Right. So if you don't see both eyes, if you're not using both eyes, it's going to be hard to be well coordinated. You won't exactly know how far things are away from you, or how close or far away they are from other things around them, other objects around them. So if you try to say something that I had a problem with was hammering a nail. Wow. So I mean, I still do have a problem because I haven't gone through sufficient therapy to deal with that, because I'm a little on the older side. People that are this old, it's a little bit harder to reestablish those brain connections at this point. So, but as far as even driving, how close are you when you do parallel parking? And if you can't judge how close the car is to other cars or to the curb, you're either going to underestimate or overestimate. Right. It's a difficult thing. And
hey, we're done with Jared's surgery, and he's eating Zaxby's. Jared, you said you had a question for me.
Do chicken fingers move every time you eat them?
Oh, that would be gross.
Oh, also, in Zaxby's, they call everything with a Z, so I'm having Zicken.
Zicken. And I'm having Zotter. Is that what you wanted to tell me? Uh-huh. How do you feel after your surgery?
I don't know, my ear just feels in pain.
Sorry. Okay. He is on about 4 different pain meds right now.
At Zaxby's, they always name everything with a Z, like salad, spaghetti, noodles, and soup.
I don't think they have spaghetti there.
Well, soon it might be Starbucks.
Because I'm going to Starbucks.
Yep.
Hey, Jared, why don't you tell them about your surgery, what it was like?
Yeah, I didn't feel anything at all. I was asleep. Well, it was actually fun sitting. It's actually fun laying on the bed. Because, well, it's not really that comfy. But, it is fun laying on the bed. And, I had to... And then so there's this part where I had to drink water out of my veins. And then when the nurse gave me the shot, it didn't feel. Well, I did feel something, but on the second one, I felt nothing. But it kind of really hurt. And then so they start putting tape on you, and then when you take it off, you might see every time it takes it off, it kind of hurts a little. Hey, look, a chocolate chips.
Chocolate chips?
No, I said truck with chips.
Oh, okay.
Why would I say chocolate chips? They taste good. So, where were we again? Oh, yeah. And then so when we're done, when you're done, you might get like a Band-Aid when one of the nurse takes everything from when you had to drink water out of your veins. It might look like this.
It's called an IV.
An IV. So I'm gonna show you what it looks like. This is what happens. Okay. Ooh, can I show them what they did to my ear?
If you want, just don't take the cotton off.
See? This is what they had to put it. So, okay, so in doctors, I did this one. If you take out the D and if you put a Z, doctors, and also in hospital, take out the H and put a Z, hospital.
Excellent.
Bye, YouTubers. Subscribe.
Mama's too hot for Christmas. Papa's too busy to know. Take me away to a winter chalet in Utah or Idaho.